G'day everyone, it's Dr. Nick Coatsworth and welcome to episode 3 of the Medical Talk Show. We're going to go through a lot about primary care, that is general practice care, during this episode, and soon we're going to have a guest on, Dr. Ganesh Naidu, who's a general practitioner himself, to talk about online prescribing services. But first, we need to go and revisit some of the things that we spoke about in episode 1, the pilot episode of the Medical Talk Show, and that was pharmacists, community pharmacists, prescribing medication for simple conditions. Now, I already went through an explainer on that, and I'd encourage you to subscribe to the talk show and go back and have a look at that. But this is essentially about getting medical professionals and healthcare professionals working to what we call the top of their scope of practice. And that means that if there is unused capacity and capability within Australian healthcare, we're at such a strained situation at the moment with access of patients to care that we need to utilise that to the best of our ability. Now, pharmacists are highly trained individuals that are sort of reduced to just dispensing medications and checking medication lists for interactions within the community. Now, of course, they knew that when they became community pharmacists, but I would put it to you that with 4 years of training and then many decades of experience in community pharmacy, that they, amongst other health professionals like nurses and physios and occupational therapists, there is room for them to step up and fill some of the gaps that we have in our primary care access. And one of the suggestions has been that they could and perhaps should prescribe medications for a range of simple conditions. Now, of course, this is the province of general practice in the Australian healthcare landscape at the moment. But there are problems with general practice that are not going to be easily remedied. The one that we'll be most familiar with is you can't get in to see one generally for several days, if not weeks. Now, you can get in if you tell the receptionist that you're really unwell, but I think most people's experience is that there's a bit of a delay. If we're sick, we need someone on the day. That's why we're calling a general practitioner. And if we can't access them, then we have to access alternatives for care. Now, that might be telehealth. It might be an online prescribing service, or in the future of healthcare, as the Pharmacy Guild and the Pharmacist Society of Australia would have us go, that might include going to a pharmacist. Now, the Australian Medical Association, the Royal Australian College of General Practitioners, are vehemently opposed to this. They have put out media releases suggesting that this is dangerous for patients and that indeed patient deaths may occur from this. Now, I think that is quite an extreme view. I think that provided that there are very straightforward protocols, that pharmacists have gone through postgraduate training and this is a limited range of conditions, I think this can work. That's not to say I don't understand where the AMA and the RACGP are coming from. A lot of the simple conditions that we're talking about, like urinary tract infection or asthma, they can look like those two things, or symptoms can look like those two sorts of things, but really be masking something very, very serious. It's not as though general practitioners themselves get it right every time. It's not as though myself as a respiratory or infectious disease specialist gets it right every time. So the argument the pharmacists will get it wrong all the time is not exactly cutting mustard with me, and it certainly doesn't mean that this shouldn't be tried. Now, the AMA are so keen on putting the kibosh on this that they've put out an online campaign entitled You Deserve More. What they're suggesting is that Australian patients deserve more than pharmacists prescribing medication to them. I don't think that's going to gel with patients, and I don't think it's going to gel with pharmacists either. Imagine being a profession, an entire profession, and being told by another profession that you can't do something that's relatively straightforward and simple and that you think you can do. I don't think that that's going to get a lot of support for the Australian Medical Association, but it is important when we sort of state these contradictory views that we offer an alternative. What could the AMA and what could the general practice leadership actually be doing to be a bit more constructive here? Well, there are genuine concerns. And when you have genuine concerns, sit down at the table, articulate them, and be part of the process. There might be things that it is ridiculous or it is dangerous for pharmacists to do, in which case sit down and state those and get them out of the picture. But to say that it is too dangerous on the whole for pharmacists to be prescribing, I think does two things. Firstly, it unnecessarily marginalises the AMA at a time when we need them. We need the Australian Medical Association to be the leaders of healthcare reform in this country. But to be leaders, sometimes you have to get away from the old traditional doctor method. Here I am, Dr. Smith or Dr. Coatsworth or whoever at the top of the pyramid and everyone has to be below me. That hasn't been around, in fairness, since the turn of the century, since I became a doctor. Now, you're still very skilled as a clinician, as a doctor. You've still done your 4 to 6 years training and your 10 to 15 years postgraduate training. But if you really want to be a leader, you can't sit there and lord it over the other professions. That hasn't worked for many, many years. And unfortunately, I think the AMA and the RSCGP have moved back into that sort of mode. So I would strongly encourage medical leaders around the country to sit with their colleagues and work out a pharmacist prescribing model that is safe and works for the patients of Australia. Because quite frankly, I don't think we're going to get the number of GPs that we need to get people seen on time. And we actually need people, particularly in rural and regional Australia, to actually be able to access their healthcare. That's the pharmacy prescribing issue. Now there's another prescribing issue. We're going to go into this in a little bit of detail with our guest, but I wanted to just frame it for you. Online prescribing. Now, this is something that's turned up. I think it's kind of American, and anything American you have to, particularly in healthcare, you've got to treat with a pinch of salt. So I can understand why people have got some concerns with this. But essentially how it works is if you've got a certain condition, like me, I take blood pressure tablets every day, and you can't get to your GP or it's not particularly convenient, or maybe your general practitioner has left your rural town and you don't have a GP, then you can get online and you can actually fill out a form saying that you're regularly on the medication, give some information. It is via a ticker box, sort of checkbox, and then a general practitioner in the back end views that and issues the prescription. There is no face-to-face interaction. And so that's how it's different from telehealth, which we would understand as me talking to you on a telephone or a video in real time. These consultations have exploded around Australia. Instant Scripts, which is the leading provider, estimates that it runs through about 1 million prescriptions a year. We're going to talk to Ganesh Naidu from MedMate, but there's others like Eucalyptus and Pilot and other services that a lot of young Australians use in preference to a general practitioner. So there's a market for these services. And yes, the market can be driven by convenience. And yes, we have to be able to tell the public when convenience perhaps isn't what you should be looking for. But that's an education issue. Unfortunately, the position of, again, the Royal Australian College of General Practitioners, this time with the Medical Board of Australia, is to state quite clearly that they do not endorse this asynchronous prescribing, this disconnected prescribing between doctor and patient, that the concerns are too great that there might be adverse outcomes from this, that they want to actually regulate it out of existence. It sounds like a problematic market intervention to me, but even more, it sounds like a really massive hole that's going to be created and not going to be easily filled. Now, I think that there's a better way to do it. I think the way to do it is to make sure that there's appropriate clinical governance mechanisms. Clinical governance means the systems that you have in place to ensure continual, safe quality improvement from your services. Now, I have to say that when I heard of Instant Scripts for the first time, just as when I heard of pharmacy prescribing for the first time, my hackles got raised. My instant reaction as a doctor with my training was to say, this doesn't sound very good. And then I found out that on the board of Instant Scripts, they had some serious contenders in terms of people who understood quality and safety. People who have been around for a long time including a surgeon from Western Australia who I was his intern in 2002, thought he was a great bloke then, but his career continued and he became Chief Medical Officer of Western Australia. So Instant Scripts is not backed by idiots. It's backed by people who understand medicine. And I think that's here where the medical board might have got it slightly wrong. Instant Scripts, MedMate, Eucalyptus, these online prescribing services are keen for continual quality improvement. They are keen for self-reflection. They are keen on clinical governance. And what's more, because it's all online and digital, arguably they have better statistics and better means of improving their own quality than most general practices do. So again, this is a little bit like the pharmacy prescribing issue. What is the problem with the College of General Practitioners and the general practice leadership working together with these organisations, who I might add, are all GPs themselves and often members of the college? What is the problem with working together with these guys to make sure that this service continues, that it continues for young Australians, that it continues for Australians in rural and regional areas? Why would you take a position where you effectively use the regulator to regulate this out of its existence? Now, it's important that I mention that this consultation is not, the consultation's closed, but the outcomes haven't been released by the medical board and they might not be released until well into 2023. But the draft consultation paper quite clearly said that the medical board does not endorse asynchronous prescribing, that is prescribing that does not occur in real time between the doctor and the patient. As a result of that draft, every single insurer in Australia, every single medical indemnity insurer has pulled funding from asynchronous prescribing. So that if I, as a doctor with my prescriber number, go and prescribe something asynchronously, my medical indemnity won't cover it. That is a really astonishing and unprecedented intervention by a regulator that has effectively led to the removal of the ability to insure these providers before the consultation has actually been concluded. I think this has gone right under the radar for a lot of the media. But for me, I have deep concerns for young Australians. I have deep concerns for Australians in rural and regional areas. And I really hope that the medical board, although I'm not particularly optimistic, are going to give due consideration to a safe way to continue these services. And of course, I've been talking a lot today about general practice, and it's important that I don't give the impression that I'm somehow against general practice or general practitioners. I'm largely talking about the leadership of general practice in this country. And if you want to have a look at what I genuinely think about general practice, check out episode 2 of the Medical Talk Show, where I have a great chat to Paresh Dowda, who's a really forward-thinking general practitioner here in Canberra, about what the future of general practice could be like. Because remember, we have to do this together for the Australian community. And I believe that there is a fundamental value proposition for general practice that can be sold to the Australian patient community, and it can be sold alongside pharmacist prescribing, it can be sold alongside online prescribing, and if we do it right, we'll do it better than the US, we'll do it better than the UK, and we'll come out the other side with a properly reformed health system. Now let's talk to Ganesh. Now, online prescription services have become a hot button issue in the area of primary care in Australia. Online prescription services really blossomed after COVID-19 and largely as a result of the advent of telehealth. But online prescription services are a little different because you actually get onto a website, you generally tick a few boxes about your symptoms, about your past medical history, and then it's checked in the back end by a general practitioner and you get a prescription on your iPhone. It is so convenient that you might want to say, what's not to like? But the Medical Board of Australia, the Australian Health Practitioners Regulatory Agency, and the general practice leadership have had significant concerns about this type of prescribing. You might also see it termed asynchronous prescribing in the media. So today, our third guest on the Medical Talk Show is Dr. Ganesh Naidu, who's the Medical Director of MedMate. Ganesh, welcome to the program.
Thank you, Nick. It's a pleasure to be with you today.
Ganesh, talk us through your background and how you came to be involved with a service that provides online prescribing.
Well, I'm a general practitioner, Nick. I've been a GP working all over Australia. I spent a large part of my time practicing up in far north Queensland. I was a GP in Cairns and looked after patients all the way up to Cape York Peninsula. And I think the concept of our service, which MedMate originated when I had lots of patients that used to come and see me in Cairns, and then they'd go back to their local communities, and I needed to provide ongoing care for them. This was over a decade ago, and it was really difficult. It was really before telehealth had really arrived in Australia. It wasn't really practical to do. But the difficulties we faced then and we still face now are, well, how do you provide care for someone remotely if someone is back in their local community, thousands of kilometres away from you? How do you provide them practical things like prescriptions, referrals, things that they need to be able to manage their healthcare? So that's how the concept of virtual care started in my mind, and over a number of years started working towards solving some of those problems. And one of the big problems was prescriptions. And we've been working with the Australian government over the last few years around electronic prescription technology, and it's been fantastic to be involved in the rollout of that nationally. There have been a very large number of electronic prescriptions issued now. It's now one of the predominant ways people receive scripts. And as you said previously, it's just so much more simpler than having a piece of paper floating around in your glove box. You've got it on your phone. It's easy to use. It's just a QR code. We're all used to QR codes now. And you just turn up to the pharmacy and they can scan it and you get your medication.
So with that description, it seems to me to be such a self-evident, almost a lay-down misere that we'd move in these sort of directions. What problems have been raised with this service, Ganesh? I mean, maybe you could talk us through how it actually works for a patient engaging with your service and getting a prescription.
Absolutely. I think the important thing to note is why people are using the service. And I think there's a couple of real reasons. One, the expectations of patients have changed. And this was a trend which has been evolving over time, even pre-pandemic, but then accelerated during the pandemic. We're all consumers of things in our lives. We expect convenience in every part of our lives. We expect it in banking. We all use internet banking now. We expect it in food delivery. We stream music. We stream all the services in our life that we need. So it's very familiar for us to be able to expect to be able to access services that we need when we need them. So that there's a pervasive underlying trend, which I think has been very important in driving why consumers are thinking along these lines. That's number one. Secondly, there's a major issue with access in Australia and in many developed economies as well. There simply aren't enough doctors in locations where we need them. This has been a long-term issue. There are a lot of people working really, really hard to solve these issues, but they're not simple. They're very, very complex. But that's where virtual care, telehealth has really come to play a very vital role in our national healthcare infrastructure, and it's been evident during the pandemic. So communities are able to access care when they need it.
Just on that point, just on that point that you made about convenience and sort of immediacy of service. Now, I spend a little bit of time on Twitter, as you might be aware, and Dr. Mariam Tokai, who's a general practitioner who tweets a fair bit as well, said yesterday in a tweet, in response to some negative press about Instant Scripts, which is, I think, one of your competitors, but also provides online prescription. She said, fast food is bad for you and so is fast medicine. How do you respond to that?
I think I would look at it in a different way. I think we would all agree, and we've all been trained as GPs. I think one of the things that was drummed into me during medical school was that we need to be patient-centric. And that patients need to be at the centre of the journey. And when you take that mindset, we want patients to be empowered to take control of their health. So anything that we can do to make things simpler, we should do. And services like ours are just one tool in the toolbox. The health the health system is under enormous pressure. It's a very complicated problem to be able to solve. The issue of fragmentation, where patients find it really difficult to navigate different parts of the health system, it's a really, really big problem. But I think if we break it down into, let's put the patient at the centre of the journey, put ourselves in their shoes. If you're a patient that's in a rural or remote community and you're unable to access a primary care physician when you need them, what are your options? And the options are limited. They are do nothing and become unwell, or go to a local emergency department and unnecessarily use resources. They're not great outcomes for anyone, not great outcomes for the patient or for the healthcare system. So my perspective is, let's provide access the most convenient way we can.
So I think everybody watching it would have a lot of sympathy with that view, but I guess we've got to differentiate here between what we call synchronous consultation and asynchronous consultation, which in lay terms and from a patient's point of view basically means a telehealth conversation that is either direct with the practitioner, like I'm talking with you, that's a synchronous consultation. And then there's an asynchronous consultation, which is you fill out a form online, the practitioner reviews it. Can you understand the concerns that have been raised about that second form of care, and how do you respond to that?
I think there's a lot of misunderstanding, probably the way I would characterise it, about how services online work. The way our service works, and I know Instant Scripts is very similar, and I'll characterise them as colleagues, I wouldn't characterise them as competitors, is that we're using different means of communication. As we were saying before, expectations have changed of patients. I'm sure you and I and everyone listening to this would probably spend most of their day communicating with their friends, families and colleagues using digital means, email, text message, chat. That is the most predominant way people communicate these days, particularly people who are younger. My children really don't use voice. I actually find this quite surprising when I watch how they interact with their friends. The concept of calling someone is actually quite foreign to them. They're very used to being able to use digital communication to be able to talk to the people that they need to. So if you look at it from that framework, we're just providing a simpler, more convenient way for a patient to access health when they need it. At the end of the chain is a medical practitioner, and I have complete trust in the medical practitioners that work in this country, that they use that information as a way to conduct an efficient consultation. And that consultation may be, hey, I need to clarify some information with that patient. I'm going to text them and clarify some dosage information or indications of why they're on that medication before I prescribe. Or, you know what, I may now need to pick up the phone or do a video consultation to complete my consultation safety. But from my perspective, the doctor receives information in a structured way. It helps them consult efficiently, and then they use any communication method necessary to complete that consultation.
So it's interesting that you say that, because I think that is a misconception that this is some sort of way just to get a script for what you want when you need it. And as you say, your colleagues at Instant Scripts, I'm aware of their statistic that something like 65% of prescriptions are approved, which means that 35% aren't, and presumably go to a synchronous telehealth consultation. Is that your experience with MedMate?
Absolutely. Look, we have really strong safeguards around what we can do online, because obviously there are things we can't. So the first decision our doctors make is the request here, is the information that I've got here safe to be able to undertake online? Does this patient actually need to see a doctor face-to-face today because they need an examination, or is something urgent that really needs to be require physical examination and treatment? That's the first decision a doctor makes. And if they think, you know what, this isn't appropriate for me to look after today, they'll provide some initial advice, which will be, hey, your symptoms really sound a bit concerning to me. I think you need to do X, Y, and Z. And our advice is please contact this local health service in your area. Now that provides an initial assessment and then some very high-level advice of, you know what, we're triaging this to a local healthcare service. But if it can be dealt with online in a convenient way and simply, there's no reason why it shouldn't. And the types of conditions we're talking about are, for example, renewals of regular medications. So if you're someone that's on a regular blood pressure medication or cholesterol agent or a contraceptive, you've been on it for a reasonable amount of time, you're well versed in what the safety aspects of that medication are. It's often just a very simple procedure for the doctor to review a structured set of questions to make sure that there's nothing going on that's untoward, mainly to clarify some information with you, and then be able to issue you to that very conveniently. It saves you having to go and book an appointment with a GP, which could be 6 weeks away in many communities in Australia, and potentially run out of medication. So it just takes the pressure off GPs and hospitals for something that's very simple that can be dealt with online.
As you say there, it is likely to take pressure off. There are mechanisms for good clinical governance and monitoring quality and safety. The Medical Board of Australia has opened a consultation on their draft telehealth guidelines, but the consultation really started with a draft that said they do not support this sort of asynchronous prescribing. This has led to nearly every insurer in the country refusing to cover practitioners who provide asynchronous prescribing. What do you think this is going to do to the future of this type of healthcare in this country?
I think it's a pity that the rhetoric has gone down this line prior to doing the work into what the benefits are of using digital technology to enhance our healthcare system. And I'm the first person to say that this is evolving and that we need to work on this together in a cooperative approach to work out how can we use this tool to actually improve access for people. And things that come to mind are frameworks. Now, is there a framework that we can put together with the right stakeholders, such as the medical board, such as the colleges of like the RACGP, to provide a framework which is safe for us to be able to add this into our toolbox. Secondly, I think it's inevitable that this type of communication, this type of care is going to need to be provided moving forward. So let's embrace that, accept that. What do we need to fix? And I think one of the things we need to fix are education. So we don't learn this stuff in medical school. It's something which is very new. So I have had to work this out with our team. How do we train doctors to be able to consult safely and efficiently online? And that's something that really we should think about. How do we add that to our frameworks of training in medical school and in our primary care training prospectuses as well?
So Ganesh, just to wrap up with a final question, I've got a fantastic crew that I'm partnering with here at Screencraft Australia. I've got at least 4, possibly 5 people who are under 30 behind the cameras right now. And I'm just wondering, what message do you have to them about the impact that this regulatory action is going to have on their healthcare?
Well, I would encourage everyone to, always think about ways in which they can communicate with relevant stakeholders. So it's really important to make your views known. There was a public consultation process, obviously, with APRA. So letting them know how important this type of access is to your day-to-day life, I think is an important thing. But look, I think I'm not too concerned actually about the noise which is around at the moment. The likelihood is we're all going to adapt to a way of working. In the end, by putting patients first, that's the most important thing that we need to do. And if we can all cooperate together with the relevant stakeholders to provide a seamless way for patients to access healthcare, I think it's a win-win for everyone.
So Ganesh, I think some of those sentiments have been just expressed beautifully, and particularly the starting sentiment that this really came from your experience in far north Queensland, where people have devastatingly low access and indeed worse than it was 10 years ago when you were up there. We really appreciate your time in sharing your experiences with us and wish yourself and MedMate well for the future.
Thanks, Nick. It's a pleasure to be with you today.